Hi, I'm Sydney.
Hi, I'm Sam.
I'm Madison, and we did our project on COVID-19 in Iran.
So, a background on COVID, it's caused by the SARS-CoV-2 virus. Its clinical course, it's asymptomatic or pre-symptomatic. The infection is mild, moderate, or severe, and critical illness. The mild symptoms include a dry cough, chest pain, fever, fatigue, myalgia, dyspnea, headache, sneezing, and sore throat, whereas severe symptoms include acute respiratory distress syndrome, arrhythmias, and shock. The transmission is person to person via droplets from sneezing or coughing. The treatment, mild symptoms can be treated with supportive care and symptomatic treatment with antipyretics, analgesics, and antitussives. Severe cases may require admission to the hospital in the ICU and placement on invasive mechanical ventilation. To prevent COVID, you should stay up to date on vaccines for other diseases as well as the COVID vaccine. Use personal protection equipment such as gloves and masks, and use frequent hand washing with soap and water. Recovery and outcomes in Iran. From January 3rd, 2020 to March 23rd, 2023, there have been 7,585,422 confirmed deaths of COVID-19, with 1,450,220 deaths. As of February 19th, 2023, a total of 157,785,811 vaccine doses have been administered. 77.58% of Iran's total population has received at least one dose of the vaccine.
Information and effect on the population. So many of the inpatients hospitalized experienced denial of the disease, negative emotions, perception of support was decreased, and there were many post-discharge concerns. Important psychological effects include fear of death, anxiety, depression, and stress, which negatively affect the disease course and recovery. And also overuse of disinfectant increased the rate of already previously high respiratory infections. Effect of adopted policies. Social distancing has introduced significant hardships for low-income groups such as daily wage workers, street children, and beggars, and they're introduced as the most susceptible groups following this situation.
A few factors that contribute to the disease incidence are low education level and low income level, security status, cultural status, and high immigrant population increases the vulnerability of Iran's community in emergent events. Water scarcity and air pollution leaves its people more susceptible for diseases like COVID.
Prevention and control. In response to the rising epidemic, Iran government established several preventative measurements, closing the schools, universities, malls, and holy shrines. Travel bans were implemented between cities, and several surrounding countries closed the border they share with Iran and banned all flights to and from Iran. They also minimized numbers of pilgrims in the Fatima Shrine and all religious sites. The strict precautions and guidelines and lockdown implemented by these countries, depending on their resources, was a key factor in flattening the curve and keeping their citizens from acquiring the disease.
Healthcare policy. Iran has a universal health coverage outlined in their health transformation plan. However, widespread policy reform can be created to address the gaps in the HTP. Possible policy initiatives include regulation of the medical equipment market, overhaul of the medical tariff system, regulate disproportionate importation of medication and the lack of quality control, creation of a campaign to improve health information and challenge disinformation. Global policy change to address the unintended negative impacts of economic sanctions to better protect citizens and ensure humanitarian needs are being met. Iran's economic sanctions may have played a role in their ability to acquire necessary medical equipment. Iran was one of the first countries affected by COVID, but they had a delayed response time due to their citizens' distrust in the government and a misinformation social media campaign. Perhaps if the government introduced medical martial law or mandatory stay-at-home orders, it could have resulted in decreased transmission and overall deaths.
Thank you for listening to our presentation on COVID-19 in Iran.